I'm not sure about all doctors, but most of the ones that I've seen, as soon as you say, no, I'm not having suicidal thoughts, they just drop it. As a doctor, I would think that you could see on the face. There's only so much somebody can hide. You know what I mean? So I think by their actions and by their answers, and you could probably tell whether they're full of crap or not, whether they're throwing you, you know, a story or they're not. You know, if they're being genuine or if they're avoiding it altogether, which is what I did. So when they said, "Are you having suicidal thoughts?" Hell no, no. That was it. Nothing more was talked about it, so I don't know what would happen if I actually had said I'm suicidal. I'm assuming, and I'm sure other people that aren't doctors do as well, the movies show it, you know, you end up in a rubber room by yourself, you know, or something like that. I think if they explained the situation and they said, look, I would totally understand, and if it's something that you're contemplating, you need someone to help with that. And our job isn't to lock you up or anything like that, but it's to help you keep living.
Trust needs to be built before intrusion because every combat veteran has trust issues. Veterans will show through body language what they say, how they're feeling. I mean, most certainly. Understanding the signs that a veteran gives off on whether they're happy, whether they're in distress, whether they want to run, whether they want to kill themselves. Because, you know, there obviously isn't a certain criteria of what we do, but from all of the combat veterans I've met, we do a lot of the similar stuff. A lot of similar things. The isolating, the depression, the drinking, the wanting to run away, the outbursts, days without sleeping, you know, sitting with your back against the wall, not going to a crowded place.
For me, it was really hard just talking about it, even though there were other guys with similar situations as me. But I just couldn't let it out. But it helped me out a lot to speak to people with the people I feel comfortable with. But another reason why I wouldn't speak about it because I didn't like the part of me getting emotional. I wouldn't like people seeing me cry. I was raised that way, and you know, that's the way, you know, I was shown to hide my feelings.
I still have the same problems, but I know how to deal with them better. I know how to deal with my stress. I know how to deal with impulsive actions. And so you learn a different way of how to live. You don't learn to forget or not have the same problems that you have, but you learn to deal with them. And it's a lot better life that way. So it gives them hope, I think.
The last time I had a suicidal thought was a couple months ago when everything came crashing down on me as far as school, what I found out about my child support, not being able to get a job. Yeah, I did briefly have a thought there, but it alarmed me and I immediately called my mom and I told her, I said, I'm having thoughts, can we talk? And we talked for about 2 hours on the phone. So I'm really been working hard on trying to accept what happened in the past.
I was just thinking about the negative things in my life, and I wasn't thinking about the good things. I was just thinking about myself. Because I didn't care about myself. I wasn't thinking about the people that I was gonna hurt if I wasn't around no more. I see my daughter 4 days out of the month. Every time, I don't know, she notices if I'm sad, she'll come up to me and just simply ask me, "Are you okay, Daddy?" Even though I'm not sometimes. I tell her that I am just to see a smile on her face. Just to keep her happy. And the thought does come into my mind, of hurting myself or killing myself, but the other thing that stops me from doing that is my daughter. I think about me not being around and her growing up and not having her dad around. I guess that's the only reason why I haven't done it. Her.
So it's a simple question. Do you ever feel that the pain gets so bad that you just would rather not be here? That you just want to maybe end it all? And surprisingly and unfortunately, you hear a lot of people saying, yeah, I think, it's just not worth it to live this way. And that's when I think we usually train ourselves to do a little bit more and ask more questions that might offer some insight to why they hurt.